Hello, my name is Dr. Jennifer Gertz. I am an associate professor at the University of Washington and the director of the LEND program. I am a white woman in my early 40s. I have long dark brown hair. I am wearing black glasses today and a green striped shirt. I use she, her, hers pronouns. And today I'll be presenting ECHO Autism Washington, Increasing Autism Diagnostic Evaluations in Primary Care. As a bit of background, we know that there are a woefully insufficient number of autism specialty care providers, which contributes to very long wait lists for a variety of autism-related services, especially autism diagnostic evaluations. Providing evaluations outside of specialty care, for example, in primary care settings, has been one solution proposed to at least partially address this waitlist crisis. Providing care in primary care is a more widely accessible and sustainable approach and worthy of further explanation or exploration. So one model for building capacity in primary care that has been widely used is Project ECHO. ECHO uses a telementoring approach with a hub team of content experts in a particular area. And then a community of participants. Many of the ECHO programs that have been used to date have had a community of primary care providers as participants to build capacity for specialty care in a generalist setting. It's also been recently widely used in the field of autism, and there are a growing number of these ECHO Autism programs that originated from the University of Missouri, and we have joined the fold. So I'm excited to present on our ECHO Autism Washington program, which included 77 primary care providers in our state and focused on building capacity for diagnostic evaluations for autism in our state. We are an interdisciplinary hub team shown here in the picture below. This was our first year of ECHO meetings and shows a variety of different folks in our center here. We have autistic advocates and family advocates that have been part of our hub team from the beginning. This was very important to bring the lived perspective to our ECHO sessions and to our primary care providers. And then in the upper right, there is a picture of our Zoom participants who join us again, who are mostly pediatricians and primary care providers in our state. We do 2 sessions monthly, and each of our participants, we ask them to present a real patient and family that they're seeing in their clinic, de-identified. So to look at outcomes, we took surveys, survey data before, during, 6 months into ECHO participation, as well as at the end of 1 year of ECHO. And our surveys asked a number of different questions about practice patterns related to autism diagnostics, perceived barriers to providing autism-related care in their own clinics, as well as perceptions of self-efficacy in a variety of different autism-related care areas, including autism characteristics. We analyzed change over time using linear mixed modeling. And then we had a convenience sample, comparison sample of medical providers who were diagnosing and seeing patients for diagnostic evaluations in their clinic, but who did not participate in ECHO. And then lastly, we looked at diagnostic referral patterns to the Seattle Children's Autism Center, which is the largest autism specialty care provider in our state. So what did we find? We found lots of change. So the graph on the right shows a significant increase in the number of autism diagnoses that were self-reported by our providers that they had given in the past 6 months. So significant increase after 1 year of ECHO participation in the number of autism diagnoses that they independently gave. We also found that providers who participated and attended more ECHO sessions gave more diagnoses. So this was exciting because it showed us that there was some sort of kind of additional benefit to attending to more ECHO sessions. We also found that our ECHO providers made significantly more autism diagnoses than that comparison group of non-ECHO medical providers after 1 year. And then lastly, we were able to validate these results by looking at referral patterns and found that ECHO providers over the course of their ECHO participation, made significantly fewer external referrals to our Autism Diagnostic Specialty Care Center at the Seattle Children's Autism Center. And for the subset of providers who participated with us for several years, we found that those results sustained over time. The number of reported barriers to providing autism-related care also significantly decreased. This graph shows a significant reduction in perception of barriers in providing autism-related care in their practices over time. And then I don't have a graph of this, but the inverse is also true, that providers report experiencing more confidence in their understanding of autism characteristics and various aspects of autism-related care. So in summary, providers who participated in our ECHO Autism Washington program changed their practices. They made significantly more autism diagnoses after 1 year of ECHO participation, and these findings were validated externally by looking at these referral patterns to the Seattle Children's Autism Center. Providers also felt significantly more confident in their ability to care for autistic children in their own clinics. One really exciting thing about ECHO is that it's fairly cost effective, and it can be relatively easily scaled up for higher impact change. So you could imagine that this can have large impact in increasing the workforce and hopefully diminishing the gap in unmet autism diagnostic service needs. So that's the end of my formal presentation. I have several questions here for discussion and welcome any questions at this time. Thank you.